Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Sindhu from Apollo Cradle and Children's Hospital. She is going to talk about role of a gynecologist in cancer screening. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Good afternoon, one and all. Welcome to this interesting topic of cancers. So nowadays there is a big boom about this. Uh, so I think most of you will be aware of cancers. You can you will be at least aware of gynec cancers. So I'm really interested to give you little enlightenment on these cancers. When we say it's gynec cancers, we include cervix, vagina, the vulva, the ovaries, the uterus, and breast cancer. But among all, there are certain rare cancers also. We are not going to get into the detail. The most four commonly occurring cancers will be cervical cancer, endometrial, that is the uterine, breast cancer, and the ovarian. So I think cervical cancer, most of you will be aware because most of your relatives or someone in the family um, will be having, or at least they would have gone for screening sessions, which are called as pap smears. So, this term pap smear you will be more aware of, right? That is what we are going to use in the cervical cancer. What is this screening tool? We know how to diagnose cancers and all that, but what is screening? Screening is nothing but we are trying to find out uh, cancers at a very early stage so that she doesn't progress into a very bad stage, and where the recovery becomes very difficult. So when we start screening, we are catching cancers at a very early age, very early stage, and we are trying to treat it so that the recovery is very good. Uh, so next will be, yeah, how to screen this cervical cancer. We are using a pap smear, and which is very conventional one. We've been doing this pap smear with a small spatula. We take it from the cervical region and send the cells for testing. This is how it's been done. Nowadays, we are including this HPV DNA. So, what is this HPV DNA? This is the virus which has many variants, many strains, and there are some high risk types that is causing the cancer. We are trying to catch this virus in the in the cells given for testing. So the person who's turning positive for these virus are definitely going to end up with the cancer. So we are trying to catch them early and give the maximum treatment possible. This test, how often should we take it? So we are categorizing women in various age groups as a screening protocol. So to start with, women between 21 years to 29 years. See, we are fixing this age. The reason being, they're sexually active from 21, at least, in our country. So, we are taking this 21 to 29 years, and we are asking them to do pap smear every 3 years once. So, that will give us a reflection of the cell staging and all that. And next category will be a long span, that is from 30 to 65 years. In this age group, we are giving some options. Either it can be a pap smear test, which they can do every 3 years once, or a HPV DNA testing that I told you earlier, that to be done every 5 years once, or combine both called as co-testing, and we can do it every 5 years once. Alright, so people can subject themselves for testing. And is there an option to do it at home? Because a lot of people are busy now. How many of you are able to really come to gynecologist for screening? Okay, yes. For the latest thing is something called a self-administered uh, pap smear. There is a kit available in the store, in the online thing. This is called as home kit, wherein the same spatula like stick kind of is given to the patient, and they have to do it at home. Slowly insert it inside the vagina and take just rotate it and take some sample cells and submit it in the lab here. This will help them to avoid appointments, and probably they can feel at ease taking the smear. All right, so this is the latest in the field now for detecting cervical cancer, a home administered test. Right. So once these tests are going to show positive, then we will guide you as to how to go in the screening protocol, as how many years once or what treatment to be done next. There are certain precancerous lesions that are detected in this, so we also guide about it. And sometimes inflammatory infections are also part of this, and we give you treatment accordingly. All right. So this ends the cervical cancer screening. And for avoiding a cancer, we are also giving vaccinations, which most of you are aware, like the HPV vaccinations. That is a total different topic. So I'm not going into the detail here. So you'll be little knowledgeable about the cervical cancer screening we are doing with the pap smear and a HPV DNA. Next comes the breast cancer. So, breast cancer is mostly seen in metropolitan cities rather than the rural areas because of the lifestyle, the eating habits, and so many things. Alright, so we are again categorizing women here. Usually, breast cancer happens usually at a later ages of life. So, we start screening women between 40 to 44, having an option of doing a mammogram. So here you should understand the age group between 40 to 44 have an option of doing a mammogram. But age group between 45 to 54, it's mandatory that they undergo a mammogram because the risk is more. Again, women from 55 and beyond, yearly mammogram is advised. So you should understand something called as high risk categories, high risk category of people who have to be subjected for breast cancer screening. So, who is that high risk category? So, for all cancers, we always say who is that risk? The risk people we catch and we do the screening. Okay, so here it goes like risk with the first degree relative, that is mother or sister, sibling, something like that. So, first degree relative, also second degree relative like aunt, and sometimes who have got exposed to radiotherapies on the chest for some other problem in the childhood. So they need to undergo. And sometimes there are certain syndromes that need screening for the breast. So this is how a breast cancer screening goes. So here the mammogram plays a pivotal role. You should understand what is mammogram. It is similar like an X-ray actually, but it has low dose emissions, radiations. This mammogram picks up some lesions in the breast. It gives a picture like an X-ray, and we find out. We read the mammogram and give you what is the exact picture. Okay, so this is how it goes. So breast cancer needs to be screened in this way. Next comes the uterine cancer. So uterine cancer, you should be someone who has a heavy bleeding or abnormal bleeding. So people at later ages, they are very scared if they have little abnormal pattern of bleeding. So they are the risk categories where we have to catch and do some screening for them. So endometrial cancer is usually caught at the early stage. This is a very wonder. We can say it's a very treatable cancer kind of. So very early stages. We are using pap smear, transvaginal ultrasound, and also endometrial sampling to detect this cancers. Yes, when I say detect, here in endometrial cancer, we don't have a screening tool here. It's only a detection of cancer because patient is already presented with a symptom. Usually, it's the abnormal vaginal bleeding. Okay, so here we do some endometrial sampling. So what is the sampling meant by? It means we are doing using a brush or a flexible tube like we are inserting inside the uterus. We are trying to scrape out some cells and subject it to the biopsy. So this will say whether an abnormality is there or normal. So endometrial cancer still does not have a proper screening tool. One more reason is there are a lot of false positives associated with it and also a lot of false negatives. And also sometimes infections happen and sometimes perforation of the uterus happens. All these are there. So still a screening tool is not properly found out and it's still under clinical trials. So only with the patient's symptom we are usually going with the detection. Alright. So this will give a brief view on the endometrial cancer. What about ovarian cancer? Yes, ovarian cancer, it occurs very very late in ages. Okay, usually whatever I say is usual phenomena, but anything out of the way, a rare phenomena can also happen at a younger age of all the four cancers. So again here, who is the risk population? Yes, we categorize people having mutations. There are mutations called BRCA1 and BRCA2. Okay, so actually both, even breast carcinoma is associated with it. It overlaps. So BRCA1 and BRCA2 mutations, and people with the first degree and second degree relatives having cancer again. And this ovarian cancer is sometimes also associated with the syndromes, wherein a colon cancer, bowel cancer is also related with it. All right. Okay. So here, what screening tool we are using is a majorly a blood test. A blood test called as CA125. So this CA125 is nothing but a tumor marker. This reflects what is the status of the patient with a cancer. Okay. So what is the range, doctor, for the CA125? Normally it's between 0 to 35. So when it is 0 to 35, we don't diagnose that patient to be having a cancer. But when it goes beyond 35, yes, it is abnormal. But is it always abnormal once it goes beyond 35? Is it elevated one is an abnormality? See, sometimes it need not be a cancer. It can be some inflammatory conditions associated with the person. It can be some endometriosis or some other lesions, an ovarian cyst. Okay, all these also raise the CA125 to a higher limits. So in that case, what is the supporting document for us? We have certain tests which supports the our finding and our blood test. Those are all CT, PET, positron emission tomography, and MRI, magnetic resonance imaging. These tests will let us know that if a patient has a cancer really or not. Okay, with an elevated blood test also. So these are supporting tests for us, and sometimes like a cervical cancer, how a gynecologist takes a pap smear. Is it possible for ovarian cases also? Not always, because early ovarian lesions do not present with symptoms, and when we do a pelvic examination also we might tend to miss only the advanced lesions presents with more symptoms, and that is how we diagnose. So ovarian cancers usually uh, picking up at a later stage, and the treatment is also not very satisfactory, and the recovery is also not very appreciable. So these are little early in the sorry late cancer stages, and usually we diagnose, we tend to get to know the symptoms and signs, like people will have a bloatedness, a fullness of the abdomen, and it can have a loss of appetite, and the bowel and bladder habits might have changed. So all these are symptoms that we have to pick up in aged persons. So this ends the ovarian cancer. So here, in the among the four cancers, we should know what is detecting, diagnosing a cancer, and what is meant by screening. So by screening, we mean before a disease progression has occurred, we are trying to catch it at the early stages. Whereas diagnosis is We are, after the cell changes have happened, we are trying to diagnose that disease. So, which might step up the treatment process. Whereas in screening, the treatment is very simple and very effective, and the recovery is very good. That is where we are trying to follow, and we are trying to apply more of the screening protocols and tools for diagnosing gynec cancers. So hope you had little enlightenment on all these. So any questions? So thank you so much for the opportunity to give you all a big enlightenment and a brief discussion. So I think some take home message will be there for at least some. Thank you so much from Apollo Groups. Thank you.